Welcome to another session of Heart to Heart. It's my pleasure to welcome Dawn Denicola, colleague of mine, at the Heart Care Center. Dawn trained at Southeastern and at Loyola University. Welcome, Dawn.
Hi, thank you.
Tell me a little bit about the Heart Care Center. I know a lot of exciting things have been happening over the last year. Tell me a little bit about what you've been doing at the Heart Care Center.
So we have aligned with the Cardiometabolic Clinic Alliance out of Kansas City at St. Luke's. We're one of more than 15 hospitals nationwide that are practicing this type of clinic for cardiometabolic health. It's been very exciting as we take an approach with kind of an all-encompassing approach with both medications and lifestyle for these patients.
Tell me the type of patients that you see in the Heart Care Center.
These are patients who are at most risk for cardiovascular disease. These are hypertension, cholesterol, diabetes, all uncontrolled with vascular disease, as well as a lot of our patients have heart failure as well, so we have that opportunity too.
Besides diet and exercise and using some of the newer medications that help with these conditions, how do you approach a patient? Have you had a patient recently that you saw that comes to mind?
I have a patient that we first saw in August, and when we saw her, her blood sugar was more than twice what it should be. In fact, we put her on a blood pressure monitoring tool, and automatically we really had to send her to the ER because she was so high. So through the months, we've got her blood sugar where it needs to be. She is exercising several times a week. She's very cognizant of her diet and has so much more energy, and it's just fun to watch how their lives can change.
That's really exciting.
It is.
You've treated some very difficult high cholesterol patients that have been unable to be controlled by their own family doctors or primary care doctors that have been referred to you. What's your approach there?
We're really explaining to them the importance of the cholesterol being at goal, helps with compliance with medications and helping them be a part of that, the plan for them, but also injections, either twice a week injections, every 6-month injections to help with compliance with those medications has been helpful.
One of the things you've been very focused on has been collecting data and comparing our performance here with top centers nationally. Can you tell me a little bit about your results as a group of the patients you've been treating?
Yeah, we've got some initial results with our data, small numbers, but what we're seeing is that a lot more we have probably close to about 40% of our patients on their return visits have been at goal with their cholesterol. Our blood sugar, patients with diabetes, we have 30% of those, their blood sugar has improved, and then blood pressure is also up to 75% of our patients have improved blood pressure close to goal whenever they're returning on their visit.
That's impressive, and these are particularly difficult patients.
Yes, these
that
are
specifically been coming to you because they've not been controlled in the community. What do you see for the future for this clinic?
It's kind of exciting. We have so many outlying cities here in Baton Rouge and patients most in need that are not right here close to the hospital. We're already seeing patients out in Livingston Parish. I'm hoping that we'll be able to go out to Ascension to reach those people that can't really come to clinic here. More use of virtual visits as well as remote monitoring to reach the patients.
That's great. And you're part of a team. Who else makes up the team of people working with these patients?
We have Dr. Smith, of course, and we have Denise, who helps us with diet and exercise training, and our nurse, Gina Briscoe, who does a great job helping us recruit these patients and get them information. And
then behind all that, you have a huge research wing as well.
Absolutely.
Collecting data and providing this as part of the national alliance that you belong to. So, Dawn, if a patient would like to be referred to the clinic, how do they go about doing that?
They can be referred through our Epic system by any of their physicians. They can self-refer. They can call our phone number. It's 225-767-3900, or go online to ololrmc.com/heart.
All right, Dawn. Well, thank you so much. It's been a pleasure to sit down and get caught up with this really amazing clinic at the Heart Care Center at the Heart and Vascular Institute here in Baton Rouge. Thank you.
Thanks for having me.
Thank you for watching another episode of Heart to Heart. I look forward to seeing you at our next one.